So, a very good morning to all of you. So, today I'm going to take my last topic for this session, that is the balance assessment. I have done balance assessment earlier with all of you, and I've also told you the various kind of treatment which can be given for the balance assessment. Today, I'm just going to revise 6 tools which are used for balance assessment. After that, I'm going to take a short test for all of you for the posture and the balance, which are going to carry marks for your practical files. So just kindly concentrate. So, if I talk about the balance assessment, in the balance assessment, there are so many important tools. TINETTI, get up and go. Timed get up and go. It is a modified version of get up and go only. Expanded timed get up and go. So this is get up and go. This is timed get up and go. And this is expanded timed get up and go. इसी का एक modification है. One leg balance, functional reach, 4 square step test, and 6 minute walk. So basically, 6 important tools: TINETTI, get up and go, one leg balance, functional reach, 4 square step test, and 6 minute walk. Get up and go के further 2 modifications: time get up and go and expanded time get up and go. TINETTI balance test. Now, TINETTI balance test is a performance-oriented assessment of mobility problems in elderly patients. It's not necessary if it is written elderly patients, then you need to do only elderly patients. There are so many other patients also. But this is a performance-oriented assessment of mobility problems. You are going to give different tasks to the person, and you are going to assess how comfortably, how properly the person is able to do that to do that task. TINETTI suggests that the assessment of mobility problems in adults should not be limited to usual history, physical exam, EMG, and CT scans. Earlier, what people used to do, if someone is having a balance problem, they won't assess what's the real problem he is facing during different activities of daily living. They will just take the history, they will just do the physical examination, MMT कर दिया, muscle testing कर दिया, everything. They will do the EMG, electromyography करके electrical activity देख लिया. They will do the CT scans for various body parts. But they won't assess what the real problem the person is facing while performing an activity of daily routine. For that, we need to give that activity as a task. जिसमें भी पेशेंट को प्रॉब्लम आ रहा है उसी एक्टिविटी को आप एक टास्क की तरह दे दीजिए एंड उसके बाद आप उसके लेवल को असेस कीजिए कि वो कितने प्रॉपरली उस टास्क को कर पा रहा है या नहीं कर पा रहा. So, in addition, the artificial setting of gait analysis does not measure the effect of environment on mobility and falling. अगर एक पर्सन है जिसको वॉक करते वक्त फॉल्स का टेंडेंसी ज़्यादा है, if a person is more prone to fall to have an injury while walking, so if you are putting that person in the artificial setting of gait analysis, एक बड़ी सी gait lab में डाल दिया, biomechanical markers place कर दिए, motion sensors place कर दिए, again that is of no use. अगर जो उस पेशेंट के मोबिलिटी इश्यूज हैं वो इन्वायरमेंट की वजह से है, वो उस इन्वायरमेंट की वजह से है जिसमें वो रह रहा है. मे बी उसका घर फर्स्ट फ्लोर पे है, मे बी जो उसका जॉब प्लेस है वो इतना प्रॉपरली स्पेस्ड नहीं है. सो देयर कैन बी सो मेनी थिंग्स व्हिच यू कांट सी इन एन आर्टिफिशियल सेटिंग ऑफ गिट लैब. So, if we go back to the studies proving the effectiveness of TINETTI, in a study of 333 elderly patients, this study was done by TINETTI and Genter. In a study of 333 elderly patients, abnormalities in the standard neuromuscular exam did not always correlate with the presence or absence of abnormalities. That means अगर न्यूरोमस्कुलर एग्जामिनेशन में जब उनको असेसमेंट किया गया इन 333 पेशेंट को जब न्यूरोमस्कुलर असेसमेंट किया गया उस टाइम पे जो एबनॉर्मेलिटीज़ थी ज़रूरी नहीं है कि उन्हीं एबनॉर्मेलिटीज़ की वजह से पेशेंट को बैलेंस एंड गेट एबनॉर्मेलिटीज़ आ रही है. सो दिस इज़ अ correlation thing. It's not necessary if someone is having a neurological problem, that problem is the only sole cause of any kind of gait or functional abnormality in the person. ऐसे पेशेंट्स जिनमें लोअर एक्सट्रीमिटी वीकनेस थी उनमें से सिर्फ 57 patients were having difficulty in raising feet from the floor. So, this kind of correlation, when was observed, at that time the TINETTI focused on developing a tool which can help the person to assess the main problem which is coming during the gait cycle, main problem which is coming during standing. This balance and gait test requires no equipment at all and a very little experience to master is enough. It is reliable and sensitive also to significant changes. जो भी patient की body में changes आएंगे उनको significantly ये reliable करता है. It reflects the position changes and gait maneuvers used during normal daily activities. हो सकता है frozen shoulder के बाद एक person properly अपने से 2 मीटर दूरी पे पड़ी एक चीज़ को ना उठा पाए, because why, he is having limited range of motion at the shoulder. अब वो पेशेंट क्या करेगा, ट्रिक मूवमेंट करेगा, अपनी स्पाइन को आगे बेंड करेगा एंड ही विल ट्राई टू लिफ्ट दैट ऑब्जेक्ट. इन द सेम वे हो सकता है, जैसा कि हमने पिछले गेट वीडियो में देखा था, पेशेंट अपने फुट को फील नहीं कर पा रहा ड्यू टू प्रोप्रियोसेप्टर वीकनेस. हो सकता है अब वो उस चीज़ को फील करने के लिए एक ट्रिकी मूवमेंट कर रहा है, दैट इज स्टैम्पिंग द फुट. अब ये स्टैम्पिंग आपको जनरल न्यूरोलॉजिकल असेसमेंट में नहीं दिखेगा. ये स्टैम्पिंग आपको तभी दिखेगा व्हेन यू विल मेक द पेशेंट वॉक इन अ नेचुरल एनवायरनमेंट. हो सकता है किसी पेशेंट के बेसिक मोबिलिटी स्किल्स ज़्यादा अफेक्ट हो रहे हो, लाइक गेटिंग अप ऑफ अ चेयर, ऑन एंड ऑफ द टॉयलेट सीट, walking a few feet. So TINETTI balance tool, it helps you to assess this kind of general tasks which the person has to do in daily routine. Now, what are the various tasks and what kind of scoring the person gives? Total score 16 का है. Total score 16 का है. Sitting balance, the patient is able to sit properly, 1. The patient is able to rise from the chair, 2 marks. The patient attempts to rise by himself, 2 marks. Immediate standing balance, as soon as the patient rises off the chair, is he able to stand properly or he is doing some kind of maneuvers to balance himself? Standing balance. Now, if you ask the patient after rising up of the chair, if you ask the patient to stand for at least 2 to 3 minutes, then is he able to stand or not? Balance with eyes closed, जिसको हम रॉम्बर्ग टेस्ट भी कहते हैं. आइज क्लोज करके पेशेंट को अब खड़ा कर दिया, देन क्या उसका बैलेंस है कि नहीं? सो फर्स्ट इज सिटिंग, देन दीज टू आर राइजिंग अप फ्रॉम द चेयर, अराइजिंग फ्रॉम अ चेयर. हो सकता है वो चेयर से खड़ा तो हो रहा है बट वो कोई ना कोई ट्रिकी मूवमेंट करके खड़ा हो रहा है, उसके अकॉर्डिंगली इसमें मार्क्स खट जाते हैं. अटेम्प्ट्स टू राइज, जो अटेम्प्ट्स वो चेयर से खड़े होने के लिए कर रहा है, क्या वो प्रॉपर है या इम्प्रॉपर है? Immediate standing balance. As soon as the patient rises from the chair, what is the standing balance of the person? The immediate for some seconds. Standing balance. Now, if you ask the patient to stand for at least 2 to 5 minutes, what is the balance? Balance with eyes closed. Okay, now with open eyes, he was able to stand. Is he able to stand with the closed eyes? Now, what is the difference in between the two? In this, you are shutting off any kind of visual perception for the person, focusing mainly on the vestibular and proprioceptive cause. Turning 360 degree. Again, this is one of the vestibular cause. One for the right and one for the left. Nudge on sternum. Now, what do you mean by nudge on sternum? Nudge on sternum. Anyone? If you can comment. Nudge on sternum. So, basically, nudge on sternum means you have to gently nudge on the sternum, and then you have to see how the patient responds. It's not just hitting. You are like, this is kind of, I told you, आपने आगे से थोड़ा सा उसको हल्का सा धक्का दिया, and you have to see, is he able to balance himself or not? You just gave one slight nudge on the sternum, you just gave one slight hit on the sternum, एंड देन यू आर सीइंग कि आपके स्टर्नम पे हिट करने से क्या पेशेंट का बैलेंस बिगड़ा या नहीं. बिकॉज स्टर्नम इज बेसिकली, यू कैन सी, इट इज अ पार्ट ऑफ द मिड लाइन ऑफ योर बॉडी. एंड देन सिटिंग डाउन, इतना खड़ा होने के बाद, नाउ व्हेन ही इज सिटिंग बैक ऑन द चेयर, इज ही एबल टू डू इट प्रॉपरली या एकदम धक्के से बैठ गया फोर्सफुली? सो मेनी थिंग्स, all these constitute 16 marks. The balance portion of the exam allows for various position changes that stress stability. What the observer should note, any movements or gestures that suggest instability, some gestures, some facial expression, some tricky movement, grabbing for support, staggering, that means swaying here and there. All these things you must notice and you should give the marks accordingly. So this was all about the TINETTI balance tool. Now if we talk about the TINETTI gait assessment tool, for the gait assessment, he divides it into 8 parts. First of all, initiation of gait. There are so many patients you will encounter who have difficulty in heel strike, like the one with the stamping gait, the one with the foot drop gait, the one with the Trendelenburg gait, the one with the Entelgic gait. Many of them will just skip the heel off part. So if the heel strike part is proper over there, initiation of gait is proper. If the heel strike phase is absent, that means the initiation of gait is improper. Step height. How much the patient can raise his foot up during the stance and swing gait. Step length. Step length I told you in the previous gait video. You can refer to that. What is step length and stride length? Step symmetry. Whatever the step the person is taking, is it symmetrical or is it unsymmetrical? कभी राइट लेग लेफ्ट लेग की तरफ जा रहा है, कभी राइट लेग लेफ्ट लेग से अवे जा रहा है, कभी पास जा रहा है तो कभी दूर कहीं जा रहा है. So this is the step symmetry. Step continuity. Is he able to take so many steps one by one, or is he taking so many pauses in between one or the other step? Path deviation. Is he able to walk in a straight line, or is he just deviating from the path like an ataxic person? Trunk stability. Is he able to maintain his core? Is he able to maintain his posture of the spine in the correct position? Or the trunk stability is lost? Walk stance. Now you need to keep the patient in walk stance, one leg behind and one leg in front. That is your walk stance. So for all these things you give scores, and this gives you the assessment of the gait, which is performance oriented. If you think of the biomechanical markers, you think of the motion sensors, you think of the cameras, yes, they are also giving you a proper gait assessment, but they are not giving phase wise assessment. That he is going into very much details. Maximum score for the balance plus gait combined is 28, lowest score is 0. The test requires just 5 to 15 minutes, an armless non cushioned chair, a walking space, and the patient's visual assistive device. That's really important. If your patient is walking with a cane, with a crutch, with a walker, you should check the patient with and without assistive devices. This all I have emphasized in the previous video also. A score lesser than 26 indicates a risk of fall, lower the score, greater the 6. A score lesser than 19 indicates a 5 times increased risk of falling. So 26 to 28 is normal. Score lesser than 26 says that yes, the patient is having a risk of fall. जितना 26 से कम होता जाएगा उतना ज़्यादा risk बढ़ता जाएगा. As soon as the score comes lesser than 19, that means the patient is having 5 times more chances of fall. So this was your TINETTI balance and gait assessment test, which is performance oriented. Now let's move on to the get up and go. Get up and go, I told you there are two modifications for get up and go: timed get up and go, expanded timed get up and go. So let's see what is a simple get up and go. First of all, the research says that Get Up and Go was tested on 40 patients with balance difficulties, and its results were compared to the force platform, which we studied in the previous lecture, the force plates, and the gate speed. Gate speed भी आपका EMG machines को साथ में use करके and biomechanical markers को capture करके you can measure the gate speed. So उन सब के against Get Up and Go test के results को compare किया गया था. अब गेट अप एंड गो टेस्ट के लिए किया क्या गया था? Patients were asked to be seated in their chairs with armrests. जो भी उनके normal chairs है. If the patient works in an office, office chairs. If the patient sits at home, the normal chair in which he is usually sits for the whole day with armrests. The patient were asked to do the following steps. These are the components of the get up and go test. So just focus. Rise from the chair. Stand still momentarily. That means first rise of the chair, and then this is similar to the immediate walking standing balance. Rise from the chair, and then after rising, stand still for some seconds. Third component, walk towards the wall 3 meters away. 3 meters का distance carry कीजिए. Turn without contacting the wall. This is very important. That means for turning your body back, you are not taking the support of the wall at all. Walk back to the chair. Again 3 meters का distance वापस पूरा करके आप चेयर के पास वापस आइए. Turn around. Again turn around and then sit down on the chair. Rising from the chair, testing your upper limb and lower extremity muscle testing. Stand still momentarily. Now what is this? जब हमारी पोजीशन सिटिंग टू स्टैंडिंग में चेंज होती है उस टाइम पे दो बहुत इंपॉर्टेंट फिजोलॉजिकल फिनोमिनाज होते हैं. First of all, when we stand up from the sitting position or the lying position, immediate blood pooling starts towards the brain. Second thing, when we stand up, उस time पे vestibular apparatus also responds to the changing positions. Now, if person is having some blood pressure related problem, or if a person is having blood pressure related problem is also known as postural hypotension. Just note down this word and go through this word. What is it? Postural hypotension. And second is vestibular apparatus. Vestibular apparatus की वजह से भी हो सकता है जब पोजीशन चेंज हो फ्रॉम द राइज टू स्टैंड हो सकता है उस टाइम पे पेशेंट को प्रॉब्लम आए. सो इफ अ पर्सन इज हैविंग प्रॉब्लम्स like dizziness, nausea, vomiting, chakkar aana, as soon as he stands from a chair. That means the person might be having postural hypertension or the person might be having vestibular related balance problem. Walk toward a wall 3 meters away. Again, assessing your posture, balance, and gait. Turn without contacting the wall. How nicely you can turn without taking the support. Walk back to the chair. अभी भी आप walk back कर सकते हैं या आप थक गए. Is there some kind of fatigue? Turn around. Again, looking for a vestibular turning. Sit down. So all these components are get up and go, and yes, come back and sit. Now, what kind of scores you need to give? For each and every component, you can give a score of 1 to 5. 1 for normal, 2 slightly abnormal, 3 mildly abnormal, 4 moderately abnormal, 5 severely abnormal. Then, if we talk about the timed get up and go test, timed get up and go test says the get up and go test is really useful, is really a good test, but the scoring system is somewhat vague, imprecise. Alternative is to score the time taken to complete the test. जितने भी components 6 components है इस टेस्ट में उन हर एक component के लिए हम एक टाइम अगर फिक्स कर दें और उस टाइम तक पेशेंट कर पाता है या नहीं वो हम देखें. That is more precise. 60 consecutive patients were recruited for a timed get up and go test. The results were compared with the Berg Balance Scale, Barthel Index, gait speed, and perceived ability to go outside alone. इन सबके साथ इसको कंपेयर किया गया एंड इसके स्कोर्स भी इन्हीं की तरह रिलायबल थे. Conclusions. So they correlated well with the work balance, gait speed and Barthel index. सो टाइम गेटअप गो अप कैसे होगा? हम कुछ कुछ सेकंड्स का उनको टाइम दे देंगे. मेडिकली स्टेबल हेल्दी एल्डरली पेशेंट्स वेरी रिटन देयर स्कोर एंड कंसिस्टेंटली स्कोर लेसर देन 10 सेकंड्स. मतलब जो पर्सन हेल्दी होगा, स्टेबल होगा, मेडिकली भी एंड फिजिकली भी, दैट पर्सन विल कंप्लीट दिस टास्क इन लेस देन 10 seconds. राइजिंग फ्रॉम अ चेयर लेस देन 10 seconds. स्टैंडिंग स्टिल लेस देन 10 seconds. ही विल बी फाइन. Walking 3 meters away, good. Turning around, good. Less than 10 seconds he will take. Coming back to the chair, he will take only 10 seconds. सिट डाउन अगेन लेस देन 10 सेकेंड। सो 10 सेकेंड से ज़्यादा एक नॉर्मल पेशेंट नहीं लेगा। जो पेशेंट इनसे ज़्यादा ले 20 सेकेंड्स, 20 to 30 सेकेंड्स, ग्रेटर देन 30 सेकेंड्स, उनके इस तरह से स्कोर्स कम होते जाते हैं। इट्स यूजुअली सीन कि जिनका 20 सेकेंड्स के अराउंड लगता है, दे आर इंडिपेंडेंट विद मोस्ट ट्रांसफर्स, दे कैन क्लाइम स्टेयर्स, they can walk and they can go out alone, but they are slow. जिनका 30 सेकेंड से ज़्यादा लगता है, that means those patients usually need help in chair and toilet transfers. They cannot climb stairs, they cannot walk alone. So these are the conclusions which I have seen in different researches for the time get up and go. If some person is taking 10 seconds for each and every component, that means he is normal. If a person is taking more than 10 seconds, around 20 seconds, around 30 seconds for all these components, that means the person is really needs some help. Then the time get up and go was again revised and turned into expanded time get up and go. Now the author suggested that by only measuring the elapsed time, we can see only one kind of problem. We should also see what how they are executing this pattern. So पहले था सिर्फ components कर रहा है कि नहीं, दूसरा टाइम गेटअप एंड गो में कितने टाइम में वो उसको कवर कर रहा है, तीसरा एक्सपेंडेड टाइम गेटअप एंड गो में उसको और अच्छे से हमने डिवाइड कर दिया। सिट टू स्टैंड फ्रॉम एन आर्मलेस चेयर, इन सब कंपोनेंट्स में एक चीज का ध्यान रखना, वी आर मेजरिंग द टाइम टेकन। सिट टू स्टैंड फ्रॉम एन आर्मलेस चेयर, initiating the gait, walking 10 meters, turn around, walk back 10 meters, slow down, stop, turn and sit. So इन्होंने सारे के सारे कंपोनेंट्स जो गेट अप एंड गो टेस्ट में थे उनको और ज़्यादा एक्सपैंड कर दिया, बट रिमेंबर टाइम इलैप्स्ड हम इसमें भी नोटिस कर रहे हैं, दैट्स वाई एक्सपैंडेड टाइम गेट अप एंड गो। गेट अप एंड गो के कंपोनेंट्स को एक्सपैंड करके उनके टाइम को हमने स्कोर किया। सिट टू स्टैंड फ्रॉम एन आर्मलेस चेयर कितना टाइम ले रहा है, गेट को इनिशिएट करने में कितना टाइम ले रहा है, how much time the person is taking for walking 10 meters, how much time the person is taking to turn around, take a U-turn, how much time the person is taking for again walking back to the chair, and how he is slowing down, how he stops himself, how he turn around and how he sits. All these components, if the person takes less than 10 seconds, good. If the person takes 20 seconds, that means there is some problem. If the person takes 30 seconds or more, that means the person is having some problem and he needs assistive devices. So these were, first of all, we did the TINETTI balance test, then we did the get up and go, get up and go को modify करके time get up and go, time get up and go को further modify करके expanded time get up and go. So these two were really difficult, and along with this, also go for the Barthel index and the work balance skill, which we have already discussed. In दोनों को भी आपने पढ़ना है. These two are really important. Not covered in this lecture because I have already done those before. The Barthel tool index and the work balance scale. Then we will go for the one leg balance test. It is a very important predictor of injurious falls in older persons, and yes, it is an immediate test which you can do without explaining anything to the patient, just asking him to stand on one leg, bari bari, turn by turn, on right and on the left. So, patients who cannot balance on one leg are generally older, देखा जाता है in elderly, and if it is of your age, if it's an adult person, if an adult person cannot balance on one leg, that means he's definitely having some musculoskeletal problem and he's definitely having the gait abnormalities, because in our gait, in our walking pattern, there are so many times when we use only single limb support. When the one leg is in stance, the other is in swing. डबल लिम्ब सपोर्ट सिर्फ 20% ऑफ द गेट साइकिल में आता है जब दोनों लेग्स इकट्ठे ग्राउंड पे हो. अदरवाइज वन लेग इज इन स्टांस फेज एंड वन लेग इज इन स्विंग फेज. सो if a person is having one leg balance improper, that means he is definitely going to have gait abnormalities. Then is functional reach, again a very quick test to assess the balance. It is the maximal distance one can reach forward beyond arm's length while maintaining a fixed base of support in the standing position. Now, what you have to do, you have to mark a point. Ask the person to stand on this point. उसको एक दूरी पे कुछ एक फिक्स डिस्टेंस पे आप एक चीज रख दो. फॉर एग्जाम्पल, आई हैव आस्क्ड द पर्सन टू स्टैंड ऑन अ पॉइंट, and at a distance, at a fixed distance, there is a table on which a glass is placed. Just imagine you are asking the patient to stand on a point. At a fixed distance from the person, there is a table on which you have placed glass. Now you ask the patient to stand still on that point. पेशेंट को अपना लेग वहां से बिल्कुल भी नहीं हिलाना है, पेशेंट को उस पोजीशन से बिल्कुल भी नहीं हिलना, एंड ही हैज टू रीच आउट फॉर दैट ग्लास. अगर पेशेंट उस ग्लास तक पहुंचने से पहले ही स्वे करने लग जाता है अपनी पोजीशन से, स्टैगरिंग आ जाता है, पैर हिलने लग जाते हैं, मतलब ही इज अनेबल टू डू एनी काइंड ऑफ एक्टिविटी वाइल स्टैंडिंग. मतलब डायनामिक बैलेंस नहीं है. व्हाट डू यू मीन बाय डायनामिक बैलेंस? डायनामिक बैलेंस मीन्स व्हाइल यू आर स्टैंडिंग स्टिल और व्हाइल यू आर वॉकिंग, हाउ properly you can do active other activities. That means multitasking kitna ho aap standing and walking mein. Functional reach is one of those tests which helps assess your dynamic balance. While you are standing still on one point, how far you can reach to lift that thing without deviating from yourself from that position. This also indicates any disturbances in counteracting gravity. Now, why we are doing this functional reach when we need to reach out for something? उस टाइम पे सिर्फ हमारे आर्म का मोशन नहीं आ रहा है. Apparently, it looks like when you do functional reach test, you are testing the arm. No. When you try to reach out something at distance, you are utilizing your back core muscles, you are utilizing the leg muscles. Why leg muscles? Because you have been instructed not to move at all from your position but still reach out for the thing which is placed. And with the arm motion, you are also moving your trunk also for bending, so you are utilizing your core muscles. So this functional reach is not testing your arm muscles. This functional reach is testing how nicely your legs can stay at a point while doing this test and how good your core stability is there. If you are doing any kind of posture adjustment or if you are swaying, deviating from a position, that means your lower limb weakness is there, you don't have trunk stability. Now, the factors that influence function reach: age. More aged persons won't be able to do this function reach test properly, so you have to score them accordingly. Height. If a person of very long height is doing the functional reach, the thing should be placed at an appropriate distance according to the height. If the patient is of small height, then place at an appropriate distance according to the patient. If a patient is having a really long height, then place the thing at an appropriate distance according to the patient's height. Now, what is the fixed distance we take? Usually 6 inches. You can increase or decrease according to the height. Shorter distance indicates substantial risk of falling. That means if a patient is not able to lift something from 6 inches, अब वो 4 inches पे उठा पा रहा है without deviating from the position, that means there is a substantial risk of falling. The patient is not having the dynamic stability, the patient is not having proper muscle power in the lower limbs, and the patient is not having proper core stability. It is also difficult in patients with severe dementia, extreme spinal deformities, obviously, severe restricted upper function. If a patient is having frozen shoulder, you can't expect them to do the function reach test. Quite obvious. And the individuals who are unable to stand unsupported, उनमें भी आप ये नहीं करके देख सकते. So, TINETTI, get up and go, time get up and go, expanded time get up and go. Functional reach, one leg balance. Now, the last two we are left with 4 square step test and 6-minute walk test. 4 square step test. It is a clinical step of stepping and changing direction to identify multiple falling. So, what we are doing in it, again, we are seeing the direction. Now, somewhere, if you look at the directions, First go forward, then take a step backward, then take a step sideways. It is much similar to the star excursion balance test which we did in the lab hours. उसमें भी यही था that you are testing the dynamic balance in different directions. The same thing we are doing over here, four square step test. We are measuring the different directions, forward, backward, sideways, and obstacle avoidance. अगर आप मैं आपको बताती हूँ ये कैसा, I will tell you. So first listen to this. We are measuring dynamic balance in different positions, forward, backward, sideways. When we change directions, when we follow instructions कि अब आप forward जाइए, now you go backward, now you go sideways, that means we are coordinated. If we are unable to follow immediate instructions, now step forward, now step backward, now step sideways, and you are unable to follow the instructions, that means your coordination is not proper. So one thing, this test is checking the dynamic balance in different directions. This is checking your vestibular functioning, and this is checking your coordination also to some extent. So how it is done? मान लो your patient is standing over here. You have these things. Either you will ask him to go forward and then come backward. Then you ask him to step backward and then go forward. Then you ask him to turn sideways and then come back. Then you ask him to again go sideways and then come back. So basically your patient का ये है neutral position. This is like the gear of the car. First, ask the patient to go forward and then come back. Then ask the patient to go backwards and then come back. Then ask the patient to go sideways and then come back. Then ask the patient to go another side and then come back. Fine, patient is able to do. The distance we take is usually 2.5 centimeter. Now another thing, we can increase the difficulty level. मान लो I have placed an obstacle over here. यहाँ पे चेयर रख दी. Now I'm asking the patient, इस चेयर को साइड पे करो, कीप दिस चेयर असाइड एंड देन गो एंड देन कम बैक. यहाँ पे मैंने एक बॉल रख दी. गो साइडवेज, लिफ्ट दिस बॉल, कंप्लीट योर डिस्टेंस एंड देन कम बैक. यहाँ पे अगेन मैंने एक बॉल रख दी. गो बैकवर्ड्स, लिफ्ट द बॉल, complete the distance and then come back. So this kind of different obstacles you have kept. How well the patient can avoid the obstacles, that is also a part of four square steps test. So you ask the patient rapid stepping, step forward, step backward, step sideways, and then keeping an obstacle, step forward, lift the chair, step back, step sideways, lift the ball, step back, step backwards, lift the ball, step forward. So these are the randomization of the steppings. You are seeing how coordinated the patient is, you are seeing the dynamic balance in different directions, and you are also checking the vestibular apparatus functioning. Again, the results were compared with the validated test, time go and up, get up and go, functional reach and the step test, and the results were quite reliable. किसी भी टेस्ट को जब हमने रिलायबिलिटी मेजर करनी है, हम उसके स्कोर्स को बाकी टेस्ट के स्कोर्स के साथ मैच करते हैं. मान लो आई हैव टेकन 20 पेशेंट्स, उन 20 की 20 पेशेंट्स में मैंने इस्टेब्लिश टेस्ट कर दिए, जैसे कि टाइम अप एंड गो कर दिया, गेट अप एंड गो, फंक्शन रीच कर दिया, स्टेप टेस्ट कर दिया. तीनों के तीनों इस्टेब्लिश थे, उनके स्कोर्स ले लिए. अब मैंने उन्हीं पेशेंट्स पे अगेन वो टेस्ट किया जो मैं इस्टेब्लिश करना चाहती हूँ, जिसकी रिलायबिलिटी मैं इस्टेब्लिश करना चाहती हूँ, लाइक फोर स्क्वायर स्टेप टेस्ट. Now I will compare that whatever scores I got in the established test, am I getting the same scores in the new test? This is how we correlated the tests with each other. So the persons who take 15 seconds for doing this four square step test, they are normal. The persons who take more than 50 seconds for performing this test, they are having high chances of falls in different directions. That's why it is called multiple falls. The test is obviously inappropriate for persons who cannot follow instructions. If a person is having some psychological problem or some condition problem, he cannot follow the instructions. So why to usually perform the test at the first place. And the last test for today's lecture is 6-minute walk test. It is an assessor and a predictor. First of all, the 6 minute walk test. We ask the patient, we make the patient to walk for 6 minutes. अब कैसे? See, this is your patient. Before starting the 6-minute walk test, check vitals. Vitals माने BP, respiratory rate, heart rate. So आप उसका 6-minute वॉक टेस्ट को इनिशिएट करने से पहले आप पेशेंट के वाइटल्स चेक करेंगे. फर्स्ट चेक द वाइटल्स. बीपी चेक किया, रेस्पिरेटरी रेट, पल्स रेट चेक किया, हार्ट रेट चेक किया. चेक कर लिया, यू हैव द रीडिंग्स. नाउ आस्क द पेशेंट टू परफॉर्म द 6-minute वॉक टेस्ट. हाउ? एक डिस्टेंस बनाओ विच इज यूजुअली, ठीक है. अब उस पेशेंट को बोलो आपने ये डिस्टेंस को छूना है, कवर करना है, एंड देन कम बैक, then again go back, then again come back. Keep on doing this for 6 minutes. जहाँ पे भी पेशेंट बीच में थक जाए वहाँ पे उसको एक चेयर दे दो, ठीक है. सो पेशेंट को आपने 6-minute वॉक टेस्ट इनिशिएट करने से पहले, बिफोर इनिशिएटिंग द पेशेंट फॉर 6-minute वॉक टेस्ट, चेक द वाइटल्स, बीपी, रेस्पिरेटरी रेट एंड हार्ट रेट. देन फिक्स द डिस्टेंस. दिस इज द डिस्टेंस. Ask the patient to go, cover the distance, come back, again go, cover the distance, come back. Keep on doing this cycle for 6 minutes. Wherever the patient feels fatigue or the patient feels tired, give him a chair. जहाँ पे भी breathlessness, fatigue, tired के symptoms आ जाए, give him a chair. And then ask the patient to come back. What you have to measure is, patient ने 6 minute में 300 meters का distance walk किया कि नहीं. ये कैसे पता चलेगा? जहाँ पे 6 मिनट्स खत्म हो गए वहाँ पे एक मार्कर कर लो. मान लो ऐसे ऐसे चलते चलते 6 मिनट्स हो रहे हैं. एज सुन एज द पेशेंट रीचेज ओवर हेयर, 6 मिनट्स खत्म हो गए, फिनिश. अब आप ये मेजर करो कि ये जो डिस्टेंस था, वॉज इट 300 मीटर्स और नॉट. अगर 300 मीटर्स से कम है, दैट मीन्स द पेशेंट इज हैविंग सम प्रॉब्लम. अगर पेशेंट को बहुत फ्रीक्वेंट ब्रेथलेसनेस एंड फटीग सिम्टम्स आ रहे हैं, इन बिटवीन ही इज टेकिंग लॉट मेनी पॉजेस, 2 to 3 pauses are advisable. If the patient is taking more than 3 pauses during the 6-minute walk test, that means the patient is having heart related problems. Patient can be having ventricular dysfunction. Patient can be having symptoms of heart failure. Patient can be a patient of COPD. The average distance which is walked by a person in between 40 to 86 minutes, 576 meters for men, 494 meters for women. इनसे थोड़ा कम है, चलता है. किसी की हाइट कम है, किसी के एनर्जी लेवल्स यूजुअली लो रहते हैं, इट्स कॉमन. इफ अ पर्सन इज वॉकिंग lesser than 400 meters, that means the person is having some lung diseases. Don't go on this language, just listen to me. If the patient is having walking for less than 400 meters, that means he is having some respiratory problems. इसलिए बाबा breathlessness आ रहा है. If the patient is walking lesser than 300 meters, that means he is definitely having some heart related problem, because improper circulation होगा, उसकी वजह से improper breathing pattern होगा, oxygen proper नहीं जाएगा. That's why he is taking so frequent pauses and he is finishing so less distance. यूजुअली 6-minute वॉक टेस्ट को हम करते हैं किसी पेशेंट में उनका एरोबिक कैपेसिटी देखने के लिए, टू मेजर द कार्डियोवैस्कुलर एफिशिएंसी, टू मेजर द रेस्पिरेटरी एफिशिएंसी. देन इफ अ पर्सन इज has gone undergone through some lung transplant surgery, or if the patient has undergone through some cardiac related surgery. After that also, we assess the patient with the 6-minute walk test to see how much he is scoring. Then we will give the aerobic rehabilitation, cardiac rehabilitation according to the scores we obtained, and then we will again, after 1 month or so, we will again do the 6-minute walk test to see the proficiency of our treatment. And there's one more thing, फिनिश करने के बाद भी अपने पेशेंट के वाइटल्स दोबारा से चेक करने हैं. चेक द वाइटल्स, 6 मिनट वॉक टेस्ट. देन जहाँ पे फिनिश हुआ अगेन चेक द वाइटल्स, कंपेयर द स्कोर्स, कंपेयर द डिस्टेंस कवर्ड, कंपेयर द क्लिनिकल सिम्टम्स ऑल्सो, एंड देन correlate everything and then come to a conclusion. So, thorough evaluation of patients require balanced evaluation of the patient requires assessment of the patient's gait and balance. Several tools are available to you. TINETTI, get up and go, time get up and go, expanded time get up and go, one leg balance, functional reach, four square, 6 minute, and which I have not covered because I have already taught you. Star balance test, figure of eight test, work balance scale, Barthel tool index. All these tools are available to you. You will choose your tool depending on the time available with you, the space in your clinical area, the patient's ability, the patient's age, the patient's clinical condition, and physician's preference also. So, very, very thanks for your attention. If you have any kind of questions, you can leave your questions in the doubt section. I'm always in the comment section. I'm always there for solving your doubts. We are finished with the lectures for this session, with the theory lectures, with the practical lectures. I'm going to conduct a test for the posture and balance. Be prepared for it. Accordingly, you will get marks in your practical files. So, stay safe, students. Any doubts in any of the previous lectures I have taken, you can ask me anytime. Bye bye.